Hello, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about the difference between Lyme disease and relapsing fever. So, Lyme disease is largely caused by the bacteria called Borrelia Bugdorferi. And it was named after Willie Bugdorferi, who was a scientist in Montana that actually identified the spirochete that causes Lyme disease, and so it was subsequently named Borrelia Bugdorferi. And Borrelia, however, has a lot of different species. So Borrelia is the genus, Bugdorferi is the species name. Relapsing fever, tick-borne relapsing fever, TBRF, is also a tick-borne illness that's caused by a Borrelia species, but it's not Borrelia Bugdorferi, and it doesn't necessarily cause mild fevers. Many of my patients have relapsing fever and do not have fevers. So that's a misnomer. A lot of patients do have low-grade fevers, 99 to 100, but a lot of patients don't. So that's a misnomer. Relapsing fever is largely caused by Borrelia hermsii, Borrelia Myamotoi, Borrelia turcata. Those are the three main ones. Borrelia Myamotoi largely affects the brain and causes severe neurosymptoms. It's by far the most difficult to treat and the most it just causes terrible brain fog and really affects the brain quite a bit. And however, all of the Borrelia do respond to the same antibiotics. Now, that doesn't mean that person X and person Y are going to respond to the same antibiotics the same. Doesn't work like that because there's epigenetics involved. In other words, your genes are very important in how your body responds to antibiotic therapy. Some people handle doxy, some people handle amoxicillin, some people handle zithromax, some people handle Biaxin, some people handle it all, and they don't have any problem at all. So, one of the things that you have to figure out as a practitioner, and as you practice year after year, you get better at figuring out, oh, this patient's going to do better on doxy. This patient's going to do better on amoxicillin. So it kind of becomes, for lack of a better way of saying it, it becomes a sixth sense, so to speak. There's definitely an intuitive piece to dosing these patients, for sure. And that just comes with experience, just like in any profession. The longer you've been doing it, the better you are at it. And that's because you pick up nuances. If you're paying attention, you look at patterns. And the same is true in tick-borne illness. So I want to just make sure that you understand that Borrelia Bugdorferi is Lyme disease, and Borrelia Myamotoi, Borrelia hermsii, and Borrelia turcata is relapsing fever. They are both Borrelia genus, but not species. Okay? They do respond to the same antibiotics as well. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.